This is the knowledge portion of my injectables checkoff video. I'll be talking about the different routes of injection administration. So the first one is the intradermal injections. For intradermal injections, you must use a 25 to 30 gauge needle and a needle length of 1/4 to 5/8 inch. You do have to use a 1 ml syringe, and you do go at a 5 to 15 degree angle. The max amount of meds given for this kind of injection is 0.1 ml. The typical site is the ventral surface of the forearm, upper chest, and upper back. When giving intradermal injections, say it was on the ventral surface of the forearm, you must first pull the skin taut. You must make sure that the bevel is up on the needle, and that when you insert it, an 1/8 inch in, so that the bevel is covered, you then inject in the medication until you see a wheal or a bleb. You then advise the patient not to apply pressure on it, not to itch the site, and just to leave it be. And then have them go to a nurse within 48 to 72 hours to have their arm read. The second type of injection is the subcutaneous injections. For subcutaneous injections, you have to use a 25 to 30 gauge needle and a 3/8 to 5/8 needle length. You do use a 1 ml syringe or an insulin syringe, and those are measured in units. The angle depends on how much subcutaneous tissue you can pinch. So if you can pinch more than an inch, you have to go at a 90 degree angle. If you can pinch less than an inch, then you have to go at a 45 degree angle. The max amount of meds to be given for this is 1 ml. The typical site is the abdomen, 2 inches away from the umbilicus, the backs of the arms, the interior thigh, the lower back, or upper buttocks. So when you're giving in subcutaneous injections, say it was on the lower abdomen, 2 inches away from the umbilicus, and I can pinch more than an inch. Now I have to go at a 90 degree angle, and I'm still pinching the skin. I will insert the injection at a 90 degree angle. I will then release the skin, and then I will inject in the rest of the actual medication. I will apply gentle pressure, but I will make sure to tell the patient not to massage the site. Just apply gentle pressure and make sure not to aggravate it by itching the site or by touching it constantly. I would just make sure to tell them that it will be sore or it'll be tender for a few days. Just don't aggravate the site. And then lastly are the intramuscular injections. For intramuscular injections, you typically use a 20 to 24 gauge needle, and needle lengths are 1 inch to 1.5 inch. For these, you do have to go at a 90 degree angles, and the max amount of meds given depends on the muscle. So for deltoids, the max amount of med is 1 ml. For vastus lateralis muscles and ventrogluteals, the max amount is 2 mLs. For intramuscular injections, you must make sure to use the Z-Track method as well as aspirate before injecting in the medication. I will show you right now where those muscles are on the body. All right, so to find the deltoid muscle, you must first make sure to find that acromion process, which is right here. You're going to place 3 fingers below that acromion process, so the site of injection will be right here. Again, you will go at a 90 degree angle. You will use the Z-Track method by pulling the skin firm and then injecting right at the site, and then aspirating and then injecting the medication itself. By using the Z-Track method, we make sure that the medication actually goes into the muscle and not in the subcutaneous tissue. So to find the vastus lateralis muscle, you must first place a hand on the lateral condyle, which is right here, and then you're going to place your hand on the greater trochanter, which is right here. The injection site will be the middle third of the vastus lateralis muscle, which is right here. And then to find the ventrogluteal muscle, you must place your hand on the greater trochanter. So if this is on the right hip, I must use my left hand. So I'll place my left palm on the greater trochanter. My index finger will point towards the anterior superior iliac spine. My last 3 fingers will point towards the iliac crest. So my injection site should be right here. All right there. Again, you have to use the Z-Track method, and you also have to aspirate before injecting in the medication. All right, and then I will have to advise the patient that the site will be sore or it'll be tender for a few days, but just to make sure not to aggravate the muscle by rubbing it or scratching it or doing anything to it. So I would just advise them to just leave the site be for a few days and that it will be sore.